Cardiovascular Disease by Marcel Trung Ho. What is cardiovascular disease? So cardiovascular disease is generally and usually refers to conditions that involve blocked or narrow blood vessels, which can lead to a heart attack, chest pain, or stroke. There are also other heart conditions such as those that affect the rhythm or valves of your heart, the heart muscles itself, and these are also considered forms of heart disease. There are many ways of life that are considered risk factors to cardiovascular diseases. There are modified and unmodified. The modified ones are basically the type of things that one can change. They're ones basically lifestyle where if you consume too much of a certain food or too much food just overall, it can cause one to have too many calories or energy input, while the energy output, which is exercise, is not enough to balance it, therefore leading to cardiovascular diseases because of other things like diabetes and obesity. Genetics is a non-modifiable risk factor, and they play a huge factor in people getting cardiovascular diseases, as it keeps them at higher risk of getting cardiovascular diseases through certain other things like obesity or, again, diabetes. The effects of cardiovascular diseases, there are many. There are short-term complications and long-term potential complications. The short-term complications are heart diseases that can greatly affect a person's quality of life. If a person experiences chest pains, they may be unable to exert or afraid to exert a certain amount, their full effort in daily activities, as this can cause them to develop swelling, dizziness, or other symptoms which would affect them from doing so, and thus they refrain from doing such activities. A person with a diagnosed heart disease may also live with the stress of knowing, so this is also part of a long-term or / potential complication, as the stress creates a mindset of fear and it makes one be more reserved in one's actions and day-to-day activities. The long-term outlook for people with heart diseases depends on many factors. These can include underlying heart diseases, person's reactions to the medication, and the extent and severity of the impairment. If a doctor or diagnoses you or someone you know with a heart disease, medication and healthy lifestyle regimen should be followed in order to alleviate or avoid cardiovascular disease percentages from happening. So taking a look globally, as you can see, the percentages of cardiovascular diseases or heart conditions. In Russia, you have 36.9 coronary heart disease, 21.4% stroke, and 3.7% inflammatory heart. While in Romania, it is 36.2, 18.8, and 1.6 respectively. In Poland, it is 30.5, 12.9, 3.7, and in the UK, it's 16%, 8%, and 0.6. While in the US, it is 20.9, 5.8, and 1.4. So while cardiovascular diseases develop in not only developed and well-developed countries and middle and low-income countries, as you can see that there's a correlation with the higher income countries, which is the UK and the US, which have a slightly less percentage than those that are middle to low income, like Romania and Poland. While in Russia, you can also see it also has a high, which is probably more related instead to things like a culture, which is culture and environment that is more stressed compared to a country like the US and the UK with less restrictions and legislation, which causes people to be more free in a sense. Three quarters of the world's death are from cardiovascular diseases, and they occur mainly in low and middle income countries. People in low and middle income countries often do not have the benefit of very strong and integrated healthcare programs, especially for like early detection and treatment of people with those risk factors that I mentioned before, compared to the higher income countries, kind of like the US, where the government is starting to cover obesity counseling. So they better screen and then use preventive treatments and measures in getting people to have a better lifestyle or plan, getting them out of the obesity range, which would then in turn decrease the probability of them getting a cardiovascular disease. The poorest people in low and middle income countries are affected the most. As you look at the percentages, you can see the UK and the United States versus Romania, Poland, and Russia. Looking at this graph, you can also see that the population suffering from obesity, you can see the United States and Russia, Poland, and the UK are all above the world averages. As you can see in the chart too, that a lot of these countries that are above the world average are basically these countries that are in Europe and North America. So they're usually more developed than countries in Africa and Asia. And as you can see, Africa and Asia usually have below average, also due to the strife and the political situations, which also can cause their population to have less nutrition and food sources, therefore also decreasing the probability of getting obesity and diabetes, which also would in turn affect the probability of them getting cardiovascular diseases. So again, like as I mentioned at certain times throughout the PowerPoint, the cultural issues, as you can see, in certain cultures there are higher probabilities of getting cardiovascular diseases, and that's usually due to the amount of resources they have. As you can see, a lot of countries in Asia have lower cardiovascular disease and obesity numbers than those in Europe and North America, like the United States, Canada, and the UK, as they are more developed and have more spending and resources to acquire food. Therefore, the population has more access to the food. At the same time, the social economic, again, plays a part into some of their cultural background, the types of food they eat, and the types of access of food they have. The US and the UK, being in a more developed country, they focus more on profit and efficiency, and so they have a lot more stores for fast food compared to in Asia. The way they prepare food is much different, and they might not have those chemicals which would be used in preserving foods like McDonald's. These would, of course, decrease the numbers. There's also the environmental factors again. The type of environment one lives in, living in a more restrictive or political strife country would cause more stress. This can also cause higher blood pressure, which again would affect cardiovascular diseases. The strife again would also cause the amount of resources one has, especially for food, which would decrease the cardiovascular amounts as they wouldn't have the resources to reach such levels. The way they prepare food, in some Asian countries, the types of food they eat are maybe lower fat or the certain amount of chemicals that would normally affect those in the US, thus having higher cardiovascular disease risk. As you can see, the burden of disease, the number one cause of death globally is cardiovascular diseases. It causes many people to not be able to do daily activities. It also causes many other problems, high blood pressure, stress, diabetes, and obesity are usually interconnected or connected and correlated, as you can see between the graph and the numbers that I showed previously. Also, it costs billions of dollars each year to treat or try to alleviate the consequences of cardiovascular diseases. The amount of medicine, doctor visits, and treatments that one has to go through each year costs billions of dollars globally. So what are key global health organizations? So key global health organizations are the World Health Organization, the Global Alliance for Improved Nutrition, and World Obesity Foundation. The World Health Organization, their goal is to better the health of populations internationally. They do a lot of research and try to emphasize using methods that work in other countries. As they are a specialized agency for the UN, they have a lot of information to work with. They discuss policies with those in the UN to create better consumption methods within certain countries, but also globally. Again, like I said, because they work globally, basically they have more to work with as they can look at the different methods implemented throughout different countries and see if they work and try to take those aspects and put it into another country whose programs either don't work or maybe they don't even have the program at all. The World Health Organization, again, they try and follow 6 policies which they create. They created 6 policies with over 100 countries agreeing with, and that is to raise the priority according to the prevention and control of non-communicable diseases in globally around the world. It is also to strengthen national capacity, leadership, governance, multi-sectoral action and partnerships to accelerate country response for prevention and control of diseases. It is also to reduce modifiable risk factors for the diseases, to strengthen and orient health systems to address the prevention and control of non-communicable diseases and the underlying social determinants through people-centered primary health care and universal health coverage. It is also to promote and support national capacity for high quality research and development. It is also to monitor the trends and determinants of non-communicable diseases and cardiovascular disease and evaluate the progress in the prevention and control. The Global Alliance for Improved Nutrition, basically they emphasize and support better consumption of healthy foods, try to get people to eat safer and choose healthier options in their daily consumption, using as an education like specifically in certain countries. I mean, they don't really have different policies or plans implemented in different countries. They basically use a very broad and general approach, which is basically just do advertisement and education. So they will try to have maybe like speakers come to a school, or they use poster or TV ads to try and get the population to be more aware of better and healthier nutritional options. The World Obesity Federation discusses policies with leaders to better ensure healthier food options for populations. They also advocate using educational and training programs to help people get used to and learn more about healthier consumption. So the way they initiate or implement such things is, again, by advocating with usually high-level officials to get them to implement programs within schools, or create policies that would educate or do regulation of training programs throughout the systems or country. So who am I? So I am a person who's empathetic, trustworthy, patient, and dedicated. My interests lie in helping people, making a lasting impact within the community, and combining business and healthcare. My objective is to make a difference and help the world become a better place. So the conclusion is, how do I use my skills and strengths and connect that to actually going out and working with these organizations? Making a difference would be, so the best thing to do to contribute, especially to the countries I identify like Poland, Romania, Russia, the US, and the UK, is first by understanding and creating a plan that would work in your current community. It would allow one to see what really works and what doesn't. It'd be hard to implement a plan if it doesn't even work in one's community and trying to make it work in another. Of course, there's many different cultural differences between the countries, so it is best to first create a plan that would work in where you are at. So, for instance, I work at Valley Medical, so I would use the program that I created at Valley Medical for my internship. In this case, I created a plan for obesity counseling. The obesity counseling would help people to avoid cardiovascular diseases by creating a regimen and plan that would help them decrease their weight and create healthier lifestyle practices. In this case, you would take that and bring it into a bigger scale, which would then incorporate the entire state. So you would then have to understand the social and economic backgrounds of the people in the different states and the cultural differences, and try to incorporate that into your plan. This would mean, so again, in this case, you would slowly expand from state to nationwide and then to globally. So again, my action plan would be to first create a plan, especially in the easiest one would be an educational plan. The educational plan would not take a lot of resources, and it would actually actually have a lot of impact on the community, and then hopefully impact the countries that I have said before, like Romania, Poland. In those countries, especially as they're low and middle income countries, the reason for their cardiovascular diseases and problems like obesity and diabetes is more due to the education and lack of resources. So by better educating them, they can know which resources to invest in to avoid getting cardiovascular diseases probabilities increase through their type of lifestyle or economic or environmental situations that they create. You would want to avoid things that would, in a way, stress out the population, increasing their blood pressure, or introducing a lot of fast food restaurants into the culture, which already has problems, which would then even increase the probability of them getting cardiovascular diseases even more.